Good evening, viewers. Tonight we have a guest who will help us to tackle the topic of public health, animal health in COVID-19 world. Our guest tonight is Dr. Pascal Juma. I want to welcome Dr. Pascal Juma to introduce himself and what he does, and then from there we continue. Welcome, Juma.
Thank you very much, Mr. Eric Wekesa, and to all our viewers and listeners. My name is Dr. Pascal Juma. By profession, I'm a veterinary doctor. I think there was a few hitches in terms of sound, but I hope you can now hear me. Just to repeat, my name is Dr. Pascal Juma. I'm a veterinary
Okay,
doctor by
let me
training.
mute.
Yes. Is that
Yeah,
okay now?
proceed. I was muting so that you don't. Yeah, I was muting so that you don't hear me.
Okay, thank you once again, Eric. My name is Dr. Pascal Juma, and good evening to all our viewers and listeners joining us on this platform. It's a wonderful Wednesday evening that we get to meet each other online to discuss important issues pertaining to public health. My name is Dr. Pascal Juma. I was trained as a veterinary surgeon. Veterinary surgeon is the term we use in Kenya for a practitioner who practices veterinary medicine. Veterinary medicine is the science that basically entails promoting animal health, but it is one of those areas that is least understood. So we use such platforms to inform the masses about the role of the veterinary doctor in the healthcare system. So basically, as things stand, I'm the managing director of NAYPEST Limited. NAPEST Limited is a Kenyan company that specializes in public health, pest control, and sanitation. So we are located at Muthaiga Shopping Center here in Nairobi. What we do basically is to promote public health through various means of getting rid of pests and pathogens. So as we dig deeper into the conversation, we'll give more highlights into the nitty-gritties of how we do that. So for now, I just want to be clear that what we do at NAPEST is to play our part in the role of public health, especially in getting rid of pathogens, pests. Of course, we'll give all list of pests that we do get rid of. And then we also need to understand the role of a veterinary doctor, which is basically the theme of our tonight's topic, basically the role of a veterinary doctor in a COVID-19 pandemic. We'll be able to share with you our journey, what we've done at NAPES Limited in the control of this disease that has now been with us for now close to, let's just talk of more than 1.5 years. At least now we proceed with the assumption that almost everybody knows a thing or two about COVID-19.
Okay, thank you so much for that brief introduction. My first question to you will be: is COVID-19 a zoonotic disease?
Thank you, Eric. Let me first start by maybe giving a definition of what a zoonotic disease is to some of our viewers who may not be very conversant with the term. Zoonotic disease basically refers to those diseases that can easily be transferred from man, that is a human being, to an animal. And in most cases, the disease are transferred from animals to humans. Now, in this case, the category of diseases that are easily transferable from animals to humans are the ones we call zoonotic diseases. So first things first, to answer your question, the answer is an emphatic yes, because the first case of coronavirus was actually discovered in animals, and in this case, specifically the animal that belongs to the order Chiroptera. The common name is the bat, B-A-T. That is the only flying mammal, for those of you who remember your primary school science. So yes, it is indeed true, it is documented that the virus is harbored by bats. So by way, in some other parts of the world, bats are consumed. So yes, it is the route through which the virus was traced and its entry into human. So to answer your question more directly, yes, COVID-19 is a zoonotic disease.
Okay, so there was a time we heard that animals were being diagnosed to have COVID-19. Is it true?
Yes, it is true. Over the period that COVID-19 has been with us here, various tests have been done in various laboratories across the world. And indeed, it is true that a number of animals have tested positive for COVID. The one fact that is still out there is that besides the initial point of transfer, namely from the bats to the humans, where the Wuhan market, where bats were being, the bat market where people are going to buy meat, or rather to buy bats for consumption. And that's how the virus found its way into the human population. Other tests have been done, and yes, a number of animals have tested positive for COVID-19, but the record that we have so far does not indicate that the disease has been directly transferred from other animals other than the bat. So yes, it is true that the virus, upon introduction into other animals, we are talking about domestic animals such as dogs and cats. It has especially tested positive for cats. In some other parts of the world, it has tested positive for dogs. But so far, no evidence has shown that direct or ready transmission by direct interaction with the cat or the dog or other animals where it has tested positive. But yes, that is just a wake-up call to remind the public at large that yes, the disease, or rather the virus, does occur in other animals other than the bat where it was initially reported.
Okay, thank you for the clarification. Does it mean
Yes.
then there are animals we should not keep as pets?
The answer in this regard is a yes and no. Yes, because in other parts of the world, animals such as bats, I don't want to say they are kept as pets, but they are not frowned upon like is the case in this part of the world, in this case specifically Kenya, because in African societies, bats are associated with all manner of negative stuff. They're associated with malevolence, they're associated with witchcraft. So even by mere fact of the belief and the association that people have with them, people get rid of them at first sight. And yes, I want to state here that as NAYPEST for the past 1 year, especially since the coming of Corona, we have been greatly involved in fumigation against bats. And it's something that, unlike before, we get more calls for customers so that we can come and do fumigation against bats. That means people already have a negative attitude towards bats. So to answer your question more directly, for bats, and yes, as NAPEST, we approve that people should get rid of bats because in addition to COVID-19, there are indeed other diseases and other negative things that are associated with bats. For example, they cause destruction. If they invade your house, they will destroy your house. The manure they release will spoil the ceiling. Of course, there are other diseases such as rabies. Remember, they're the primary reservoir for the disease called rabies. And remember, rabies is also a good example of a zoonotic disease that does affect especially dog. But it's a disease of dogs. But what we want the public to know that rabies, yes, does affect all living mammals. And yes, the primary reservoir of the virus that causes rabies is actually the bat. So back to your question, are there animals that people should not keep as pets? If anywhere in the world somebody intends to keep a bat as a pet, for now we discourage and say an emphatic no. And then just given the fact that the various animals have tested positive, animals that have been friendly to humans, we are talking about dogs, we are talking about cats, that doesn't mean we should not keep them as pets. We should indeed continue to keep them as pets. All we need to do is to keep them in good health. And that is where veterinary doctors come in. Because yes, these are animals that our children interact with at close level, and you never know at what level and at what time they're gonna come into contact with the body fluids. Because, for example, you see a dog likes licking a lot. So if, for example, a dog is affected by a virus, it doesn't matter whether it is COVID-19 virus, it could be the rabies virus, and indeed you can imagine that the saliva is the primary source of infection. So yes, as children play with dogs and cats, there is that high possibility of being exposed. So people should, for dogs and cats, people should continue to keep them, but with much precaution and ensure that they are at all times kept in good health, especially with the help of us, the veterinary doctors.
Yeah, we also know that in the animal world there are contagious diseases, and
Yes,
these issues to do with quarantine. Before even we COVID came, we used to hear them mostly in animals. My question
yes.
is, can we achieve social distance in animals? Sorry, we have lost him.
Hello, hello, Eric, I lost you there. Sorry, Eric, I lost you there. Sorry for the network hitch. Can you hear me now? Hello, 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 Eric. Hello. Hello, Eric. Can you hear me now? Hello, Eric.
Hi, Bhaskar.
Very sorry for that. I guess there was a network hitch.
Hello.
Can you hear me now?
Yes,
Hello,
me.
I
There's
can.
a blackout.
Oh,
There was
blackout.
there was a blackout. I've lost my internet, so I was trying to connect again.
Oh, no wonder, because I was really wondering what went wrong on my side. I thought it was my side also.
Yeah, but you are the first person to disappear, so I thought like it was a countrywide network. You first
No.
disappeared, then there was a blackout this side.
Mm-hmm.
Yeah, yeah. Just
So,
continue.
so we can continue.
Yeah, we can continue. Let me continue. I'm just connecting here. Pascal, continue.
All right. Thank you very much, viewers, for your patience. We are really sorry for that technical hitch. I think there must have been either network outage or power outage or something like that. But so far, we are back online. We thank you for your patience. So before that network hitch, Mr. Eric Kesa had asked about issues of quarantine. Indeed, what I would like to say that since the onset of Corona, the public has been now introduced and are by now familiar with terms such as quarantine, terms such as isolation, terms such as sanitizers, terms such as disinfection. These are basically terms that in our ordinary life, prior to the coming of this pandemic, we citizens who are going, or rather, we people who are non-medics who are going about their businesses, were not exactly used to these terms. So yes, in veterinary animal practice, these are measures that we commonly use to ensure that we contain the spread of deadly diseases before they reach a level whereby it would overwhelm the mainstream health system. And basically, that is what is being attempted by all these containment measures, namely quarantine, the lockdowns that you've heard about, the curfew hours. Prior to this pandemic, the only curfew we knew was perhaps due to a security situation, but at least now we are familiar with the term curfew, referring to uh, the period within which we should not be outside or something like that. So yes, Mr. Wekesa was asking if we can achieve uh, a reasonable level of management of this disease called COVID-19 just by virtue of quarantine. Sorry for that. And my answer is this: yes, we can achieve that. And indeed, as things stand, the containment measures that have been taken by the ministry, especially in terms of the quarantine, the restriction of movements, the curfew hours and all that, this has been part of what has helped to greatly to contain the spread such that we are not in a situation that is as badly as would have been the case if we hadn't had all these measures. So yes, our plea is to continue to appeal to the masses to heed to all these advice and the measures being taken by the ministry. We should indeed take them as measures, as opposed to, we should take them as measures for our own benefit as opposed to just heeding the instructions by the ministry. So, for example, if the ministry says wash your hands, do this, don't take it as an instruction from the ministry. Take it as an instruction that is there for your own good and for the good of people around you. So it's very important that we take seriously all these measures. We should never underestimate the impact of what would have been the case if we hadn't taken these measures into action. Because, for example, not many out there are specialists in fumigation, and we realize that it has been a challenge if we had so many cases whereby we need to fumigate, then even those of us who are doing fumigation would actually be overwhelmed. And indeed, when this disease sets into a family, for example, either in a family setting or in a workplace, one person has been diagnosed and confirmed to be COVID-19, you see escalated measures that are meant to ensure that we leave nothing to chance to ensure that all the areas are disinfected, are sanitized. So yes, these measures are important, and that it is also important that we play our individual roles, both at home and at our workplaces, to ensure that this disease, we curb it fully. Yes, Wekasa.
Thank you for that. What are animal rights?
Animal rights are those things that we as humans need to do to ensure that animals deserve or get the much deserved peaceful coexistence with humans. For example, animal has a right to good health, and especially so domestic animals. These domestic animals help us in various ways. We are talking about companion animals such as dogs and cats. We are talking about livestock and all that. So it is indeed the right of all these animals to ensure that we treat them fairly so that we benefit from company with them, but more importantly, we ensure that there is minimal or no transfer of disease from animals to humans. All right. So we want to emphasize to the populace that it's important that at all places, animal rights are upheld to ensure that we coexist peacefully with these animals, because you may not believe it, but without us, these domestic animals would suffer. And you know the role they play in the bettering of our livelihoods. So animal rights are very important. So just because there has been, for example, reports about some animals testing positive for COVID and all that, should not give us human beings a chance to discriminate against animals and say that, oh, these are the animals bringing these diseases. Or no, it is our role as human beings to ensure that we take good care of these animals. If there are any diseases, we work together as a healthcare system, from veterinary practitioners to mainstream human medicine practitioners, to ensure that indeed we not only curb the spread of such diseases, but also protect the interest of these animals. Yes, Wekasa?
Now, tell us more about your company, NAYPEST.
NAPES Limited is a Kenyan company registered in 2015 with the main aim of promoting public health. We promote public health through various ways. One of them is getting rid of pests. And that's why our slogan is creating a world free of pests and pathogens. Our physical address is Muthaiga Shopping Center, Nairobi. You can reach us through a mobile number 0723 777 381. I'll say that one more time, 0723 777 381. Our website is napes.co.ke. You can also email us on napeslimited@gmail.com. So NAPES was registered in 2015 by a team of veterinary surgeons keen on using our knowledge, skills, and wealth of experience to ensure that we play our part as veterinary surgeons in the enhancement of public health in this country. And one of the ways we do so is, for example, fumigation against common pests of public health significance. So we are talking about pests such as mosquitoes. Remember, if you Google mosquitoes, it is actually the world's deadliest animal. It has caused more death than corona. It has caused more deaths than even any other pest. So yes, we do fumigation against common pests of public health significance. Key among them being mosquitoes. We're talking about bed bugs. We're talking about cockroaches. We're talking about rats and mice. We're talking about snakes. Yes, in the recent past, there has been an upsurge in the number of snakes, causing a lot of bites in human compounds and places where human inhabit. So part of our mandate as NAYPEST is basically to promote public health by ensuring that these pests, wherever they are within human habitation, we get rid of them to reduce or remove the risk of them bringing diseases. This could be in an office setting, it could be at home there, could be having either bed bugs, cockroaches, you could be having mosquitoes, could be having ants, termites. So there are various reasons why we should get rid of these pests, because these pests, in addition to the destruction that they cause at individual level, we're talking about bites by pests such as fleas, such as lice, and you realize that when you talk about coexistence, some of the pests can easily be transferred again from the domestic animals that we love so much, such as dogs and cats. When children play with dogs and they get to transfer pests such as fleas and lice, they get to transfer into animals or into human beings. So our role basically is to ensure that we minimize or eradicate such incidences that might lead to diseases. In fact, we do not know in the future at what point will we have another pandemic and of what nature it will be. But one thing you can be sure that it will one way or another be associated with human interaction with animals. So yes, that is the basis upon which the team of veterinary surgeons led by Dr. Pascal Juma came on board to register NAPES Limited, a company that brings you quality pest control services to ensure that we rid our compounds, our homes, our offices of these pests. And remember, pests spread diseases of their own. For example, when a snake bites, of course, it causes, they introduce the poison into the body of the human that they bite. Pests also spread pathogens. And that's why you heard in our slogan, we talk of creating a world free of disease, of pests and pathogens. So pests also spread pathogens. For example, we all know that mosquito is the #1 vector of malaria disease, and it does so by introducing a pathogen into your body. That pathogen is called Plasmodium, the protozoa that causes the disease known as malaria. So yes, there is a good reason for that matter that everybody should ensure that you create a world free of pests around you. You do not give them a chance to multiply, because when you do, then it can be out of control. Because, for example, if we look at COVID-19 in the Wuhan case, if at the very onset, if you read keenly the history of COVID-19 at the onset, there was some level of denial and, something tried to be kept secret. Is this really true and all that? But had they known that indeed this disease is going to blow out and affect the whole world, and they did enough measures as at that level where it was first reported, things would be a lot different. And that is why we indeed say that it's important what we do at NAPES to ensure that we create a world free of pests and pathogens. And we have been greatly involved in doing so since 2015 to ensure that wherever human beings live, there are no pests. So if you see them at first, you do not wait for them to multiply, because these pests play a very key role in the spread of diseases and pathogens that can turn out to have a very negative impact on human beings.
Okay. Watch this clip and tell us what was happening. Is that your company?
Yes, that is true. That is a team from NAPES Limited. We were privileged to be the ones who were chosen to do the surface disinfection and sanitization at JKIA. So that the picture you're seeing on your screen right now is a team of NAPES staff at the Kenya Airways headquarters. In the last year, in the run-up to the opening of international flights, we played a very important role in surface disinfection and sanitization of all the areas and offices to ensure that we ward off our country of corona. It was a very difficult task because, as you all know, JKIA is a very, very big airport that is serving the East and Central Africa. I think one of the largest in Africa. And yet we had to combine every office because by the time we were doing so, there had been very many cases across the airport that had been reported. And all the areas where suspected patients had reported had to be fumigated. So among the ones privileged that we took that role to ensure that our country was safe prior to the opening up of the international flights. And we did the job diligently. And so far, since we did it, there has been very, very minimal cases of corona being reported, especially bad cases like was the case before the closure of international flights. So that was a team of NAPES staff working at the Kenya Airways headquarters. We did all the Kenya Airways offices at JKIA. Of course, we did other airports such as Mombasa and Kisumu. So this is just an example of one of the roles we play in promoting public health. Remember, surface disinfection and sanitization is a very important process in ensuring that a large area as much as possible is reached. Because at individual levels, we may do the hand washing and all that, but in public places whereby a large number of people interact, such as in airports and in hotels, where disease can easily spread from one individual to the other, and it would be actually difficult to trace the actually original source. So it was such that for every room that was suspected to be carrying a person who was suspected to be COVID positive, we did fumigate all the rooms. And you can imagine the number of offices there and people interacting and people from different walks of life, people from different areas in the estates. And by then, and even as it is right now, when people meet at a central place in an office setting, you don't know how safe the person is, from which area of the country or the city is. So it was a very, very critical role, and it still remains a very critical role that we do place right now in what we call surface disinfection and sanitization for offices, for homes. So for example, if your friend, your relative has tested positive, we encourage you to take it positively. It is not something unique. By now, we have had a number of cases. People take good measures, go to hospital, get treatment, get isolated. And then the most important thing is always to ensure that all the areas that may have been touched by that person is thoroughly fumigated through surface disinfection and sanitization. We continue to do so even for various hospitals across the country. We may not name them, but yes, we are actively involved in surface disinfection and sanitization at NAPEST to ensure that any surface where humans interact at one-on-one level is thoroughly fumigated to ensure that we rid the country of this disease. And I believe that if we do so in all areas, we should be able to curb this disease in the next 1 year or so.
Thank you so much. Another thing I wanted to ask is how do you get rid of such pests? Are snakes classified as pests?
From where we sit, a pest is any living organism that poses or rather, let me define it this way: any living organism that cohabits with a human being benefits from it, but does not confer any benefit to that human being. That is the basic definition of a pest. So to answer your question more directly, yes, a snake is a pest because as NAYPEST, we have had to handle many emergency cases over the years of our practice, whereby snakes have bitten people, and then we are called in to either physically kill the snake or fumigate the area that where the snake was spotted. I know it's a controversial issue because for snake charmers, there are some who try to protect snakes. Yes, there are those that are classified under wildlife. For example, the big cobra snakes and all that. But what we must know is that these snakes are very dangerous, and most of them actually are very poisonous. So within human habitation, a snake is a pest that should be gotten rid of as soon as possible. And we are proud that as NAPEST, we are among those who have one of the most effective fumigation drugs against snakes, and we call it snake out, and that is exactly what is on your screen right now. So we would like to encourage people that sorry, if you live in a place and you suspect it has been infested by snakes, that's an emergency. Please call our team as soon as possible so that we can help you get rid of that place, that snake, and then we fumigate the area so that the humans around there can continue to live in peace. Because I'm sure most people cannot be at peace or sleep in peace when they know there is a snake anywhere within their habitation. So this is a liquid fumigant. 250 ml mixes 20 liters, and then you spray all over the affected areas, especially potential hideouts for snakes, such as behind the fence area behind the house. And it is a very powerful snake repellent that will ensure that we create a buffer zone between you and where the snake lives. So ensure that you fumigate your own compound always, and if you have any suspicion, please always call us to ensure that we get rid of it, because snakes are very dangerous. And yes, snakes are a pest, especially for those poultry farmers. For example, you find that most of the cases we are called a person, and it is common for people nowadays to have a chicken or two within their compound in their backyard, and then they're mostly attracted by the eggs laid by the chicken. So yes, that in that way it becomes a pest because it comes to eat the snakes of the chicken. When it eats eggs from the chicken and then causes a destruction, it causes panic. When children are playing around, it can cause any. So this is a real danger for sure. If you have snakes anywhere, please take it as a big risk.
Okay. There was a time when I think Muskari Kombo was local government minister in Nairobi.
Yes, I remember.
There were a lot of rats in Nairobi, and most people are not able to handle rats.
Yes.
How does NAPES help people to get rid of rats? Are we still using rat and rats, or there are more improved and sophisticated way of dealing with that?
Thank you very much for the question. There are more improved and sophisticated ways of dealing with rats. We have fumigants that we spray across the compound, because in a typical setting, and I can say for sure that one of the governors of this country during lockdown had to come for me urgently in April to go and do fumigation at his home, because the number of rats in his home had actually exceeded his poultry, and his poultry was more than 10,000 at his rural home. I remember having to be taken by his security here in Nairobi and flown all the way to his rural home to get rid of those pests. So you can imagine how serious rats can be, and they multiply at a very high rate. So to answer your question directly, yes, indeed, NAYPEST has more sophisticated ways of dealing with these pests. especially rats and mice, because especially for poultry farmers or even a typical home setting, they can be very destructive and given a chance can multiply at a high rate. You find that, for example, in a place whereby there is a hotel that disposes food in the nearby garbage disposal point, it can be very, very difficult because as long as they have a source of food to satisfy their nutrition, the only other agenda they'll do is multiplication. So under such circumstance, always count on experts like NAPES to ensure that we put our knowledge and experience to ensure that we don't just bait them and any. But for places like food processing zones, we have another fumigant. We call it foggy bat fume liquid. That's very important. It helps get rid of rats and mice and even the bats that were initially talked about at the beginning of the program. So yes, there are very many new methods of getting rid of this pest in a professional way that doesn't cause negative impact. Because, for example, if you kill too many, for those who use rat and rat or other common, poisons such as Indoseed and all that, they may die in large numbers and then smell. If it is a business premise, it can be bad. If it is a hotel setting, you lose customers. If it is an office setting, people will not be able to stay in that office. So yes, we as NAPEST to ensure that we use the most professional and advanced means to get rid of this pest so that the environment remains clean for both human and animals to live in.
Okay, most boarding
Yes.
schools have challenges to deal with, especially bed bugs
Yes, that is true.
and seminar areas. How
Yes.
are you able to reach such places and help them to get rid of these bed bugs and other pests?
Thank you very much for that question. Indeed, it is true that over the years of our practice, we have been greatly involved in fumigation against bed bugs for most schools. We've done Kakamega High School, we've done Kisii High School, we've done Nyamira High School, we've done other schools in mostly in Nyanza and Western Kenya. So the way we reach them is they can visit our website. Then there is word of mouth, for those teachers and parents who have students in that school. They can always reach out to us, and then we organize with the administration on how we can get rid of these bed bugs. I remember there was a case last year. We went to Imperial Primary School in Kisii. We had a very serious case of bed bug infestation, and the parents were really complaining and almost threatening to withdraw their kid from that school, but we were able to contain the infestation. So one thing we would like to appeal to the managers of schools in both private and public sector is that the issue of pest infestation and particularly bed bugs is very serious and should be treated with the seriousness it deserves. Because, for example, when students close and they bring this pest to the parents, it's a big challenge. So that you find that sometimes when students are given half term, they come to their various homes. And if they were, for example, in a school that was infested by some of these pests, especially bed bugs, they bring them at home. So the parent will wonder, where did this thing come from? Because usually a half time is very brief. So the child comes and then brings some clothes, leaves the pest there, and then goes back to school. So we create a vicious cycle in which it becomes very difficult to manage these pests. So one plea or information we would like to have about the people involved in management of public and private schools is that at the earliest detection of the presence of these bed bugs or all other pests, please always call professional fumigators such as NAPES to get rid of these pests so that they do not spread to other areas, because you cannot underestimate the impact, for example, of a national school. If a national school had bedbug, for example, and a national school contains students from various parts of the country, and then they go for a break, be it half term or a normal term break, and then the students go to their various homes, and then they spread, and then they come back and all that. So before you know it, what started in one school in zone A can end up affecting the whole country. In fact, many of the times during the course of our work in this fumigation, you find a client asking, where did these things come from? And in some cases, they innocently cannot trace. Okay? So it is our special appeal to those managing schools. We do offer reasonable rates for fumigation against all pests, and then we ensure that we give discounts for those who involve us at contractual level, because most of our clients involve us at contractual level, so that we have a contractual or periodic control of this pest, so that, for example, when students are on vacation, we come and fumigate the entire environment, all the classes, the dormitories, and all that. And then the teachers' quarters, we fumigate the dining hall, all the entire school, so that when the students come, they come and find a clean and neat environment to study in.
Okay, I hope that is well answered. Another issue I wanted you to delve with is bees.
Yes.
I know bees are not pests, but in
Yes.
terms of relocation of bees, sometimes they are a little bit dangerous. How do you help farmers to relocate bees as NAYPEST?
As NAPEST, many other times we've been called to get rid of bees. One thing we need to clarify is that bees are very important insects. Of course, they're the ones that bring us honey, the much cherished food. And of course, bees also play other important roles, such as, the spread of seeds here and there, So bees are very important insects within our ecosystem. But many of the times, a swarm of bees, for example, when they are relocating by themselves, can find a nesting ground within human habitation. Under such circumstance, we as NAPEST have special equipment that we use to just collect and then relocate them. Again, we do, in fact, just to give an example, last year I had a friend of mine who lives in Ngong, and then he had traveled for work, and then all of a sudden he received an emergency call from his family that a swarm of bees had come directly into the kitchen. So you see that's an emergency. So we as NAPEST have a specialized team that do come to relocate such bees. We take them to a different place, because we also work hand in hand with those beekeepers all over the country. We are in good terms with them, and we are in good working relationship with them, so that should we have any bees that are posing danger to the people wherever they are, they just we just come with our specialized team, take them and then relocate them. We have hives that we can use to relocate them to specific places. And another circumstance is whereby a bee can form a hive, which we recently did somewhere in Dumboini. A bee had formed a hive near a school where primary, or rather nursery kids were. You see, nursery kids, when they play, that can pose a danger. Another hive had formed near an old, where there was this old lady. I don't know, in case they choose to create havoc, an old lady cannot run for her dear life. So under such circumstances, again, we bring our specialized team that are able to relocate safely and ensure that they do not return there. Again, we have some other people, for example, those who live in Mabati houses. We have various cases whereby we are called in. The space between the Mabati and the plywood, for example, that's always a common place for bees to nest and form a temporary hive there. Again, we as NAPEST have a specialized team that are able to handle such like cases. We get rid of them safely, we take them to a different nest, and then we relocate them, so that the people around there remain safe. Because as we know, despite their positive impact in the environment, such as pollination and all that, of course, when they choose to cause havoc, what we have seen over the years in our practice is deadly. Just the other week, we were called to an emergency case whereby bees that had lived in some hive near the house for a long time and had not caused any havoc just decided to kill like 6 German Shepherd dogs. You can imagine the kind of loss that was incurred by that client. So we had to, treat the remaining dogs and get rid of the remaining hive and then relocate the one that had built a house near human habitation. So yeah, that's a very important role we play. And remember, that's a very important aspect of public health. Because, for example, bees, when they are irate, when they are annoyed, when they are causing havoc, it is a great public health danger to literally all animals. Dogs, it doesn't matter, domestic animals, humans around there. And yes, for bees, they actually cause death. So that's a very serious issue that we always handle perfectly to improve the public health case. sorry. Yes, over to you, Wekesa. Over to you, Eric. Can you hear me?
Oh, higher, 1,000 per day. Oh, naambia.
Okay. Have you been involved in locusts eradication?
Not so much for this year. In fact, at the onset of Locust, we were contracted by various farms because of our good name in the field. We were contacted by various farms, but then before you know it, the corona came in, and then our focus shifted more to the knee. But yes, to corona eradication. But yes, we are very much capable of doing so. And yeah, we have been contracted by very many farmers, especially in the North Rift, where the locust had created a great havoc in that area.
Okay, so NAYPEST can deal with locusts.
Very well.
Okay, thank you. Now, there's this place you are talking about. Welcome to Pets Center Veterinary Clinic, where your pets are well pampered. Tell us
Yes.
about pets clinics and how do people access them?
Like I said, NAPEST is led by a team of veterinary doctors, and we are located at the Pet Center Veterinary Clinic, which is at Muthaiga Shopping Center. So for those who don't know Muthaiga Shopping Center, it is along Limuru Road. By public means, any vehicle that plies Limuru Road, mostly gotten from Koja, you alight at Muthaiga Shopping Center. There is, of course, a poster there, and the landmark is a Total petrol station. So at Pet Center, we basically take good care of your pets, your dogs, your cats, very well pampered in terms of nutritional care, very well pampered in terms of medical and surgical care. So it's a one-stop place that once your cat gets there, then you don't have to worry. It will be healthy. If it has pests, we will get rid of the pests. If it has any disease condition, we have the most experienced veterinary surgeons that will be able to handle it perfectly and treat it well. And we are open all the time from Monday, 9 a.m. to up to late 6 p.m. in the evening. So once you get to us at Pet Center Veterinary Clinic, you should be able to meet the entire team of NAPEST Limited, plus, of course, other teams of veterinary surgeons that should be able to handle all your animal health issues. So all the people, you're most welcome to Pet Center Veterinary Clinic. That's where you meet the NAPEST team. And that's where we are. We are on the first floor. Our our signpost is once you get to Total, the Total at Mutaiga Shopping Center along Limuru Road, you should be able to see our signpost and you will be properly guided to our physical premises. So all are welcome. You're most welcome for all your, pets, dogs, cats. You'll take good care of them.
Okay, my question then is, do we have enough clinics for the pets in Kenya generally, or
As
are
things
they
stand,
limited to a few areas?
I can say particularly for Nairobi, we do have, I wouldn't say enough, but a good number such that whichever area you are in, I think you should be able to get a veterinary clinic within a radius of not more than 7 kilometers from wherever you are. Because in the recent past, there has been young graduates who have been greatly involved in opening up of new veterinary clinics across the Nairobi and its environs, such that those who need veterinary care should be able to get them, at least not very far from where you live. Yes?
Okay, you can now answer a few questions from the audience.
Yes.
The first one is here. Let me share a few questions from the audience.
Mm.
Yeah, should we stop eating meat before these domestic animals are tested for COVID-19?
I can see from my screen the question is from Rio, and thank you very much for the question. The answer is no, because yes, in fact, at NAYPEST, part of what we do is actually meat inspection. If you have, for example, a function in which you need to slaughter a meat, be it goat, sheep, cow, chicken, for the visitors, we do offer professional meat inspection services as part of our mandate in promoting public health. So the most important thing that I can say is that you need to ensure that whichever meat you eat is inspected. Once it is inspected and approved by a qualified veterinary surgeon, then you do not have to fear. Secondly, as things stand, domestic animals that are eaten have so far not tested positive for COVID-19 within the borders of Kenya, so that as long as the meat is inspected by a qualified veterinary surgeon, you do not have to worry about eating it. Feel free to eat your meat, do not fear, if it is inspected. Next question.
You can respond to that.
Yes, I can see the viewer is asking, my goat gave birth to a young one, but the other wasn't producing milk. It died in the process. Sorry about that. We are looking for a veterinarian. What is that kind of infection, sir? I've missed the show for quite some time. I was abroad, but I'm now back. Okay, Kichwenindet. I hope I got your name right, Kichwenindet. Sorry about you losing your goat. Now, that infection most likely could be sorry, a case of mastitis, or basically what you call agalactia. So agalactia syndrome is mostly caused by some of these common pathogens that should be able to be handled. So in case you have such a case in the future, always ensure that you call the vet as soon as possible, because some of these cases can easily be handled by a simple injection. And all you need is an early intervention. So to answer your question directly, what is that kind of infection? The infection, most likely, as per your explanation, it should be an early case of mastitis and agalactia, because sometimes when the cow or the goat has mastitis, it is not able to produce milk, and when the young one is not able to suckle, then you will lose within a few hours, especially during the first day of birth.
Okay. Now, I think, in summary, you can tell us about these services as we conclude.
As we conclude, we just want to say that thank you for the opportunity. NAYPEST is your company that is here for you to help you do professional fumigation services. When you find us, you will find professionals who will fumigate your house against common household pests such as mosquitoes, bedbugs, cockroaches, rats, mice, ants, termites, bats, small garden snakes that pose a threat. We are talking about weevils, fleas, flies, and all these pests that make our life difficult. So we do it very professionally in a manner that makes it safe for you. We do not very much encourage the do-it-yourself approach because it comes with its challenges that you may not be able to handle well in the long run. So we always encourage you to engage as professionals to ensure that the work done is beyond reproach. Part of what we do, as you've already seen, we are greatly involved in disinfection of our airport. We do disinfection and sanitization of premises and surfaces against pathogens such as coronavirus. And basically, we encourage people that if, for example, you have a hospital, you have an office setting, or any other place where a person who has tested positive for COVID-19, as the person is designated for treatment and isolation, please ensure that all the areas that was where the people interacted with him or her is disinfected as a way of ensuring that we maximize the prevention approach towards this pandemic called COVID-19. So we disinfect all that areas and we sanitize the entire place to ensure that people who interact there do not get to spread the disease again. There's another component of public health that we did not touch on. We are talking about treatment of pit latrines and septic tanks. Many of the times, if you go in rural areas, you find that pit latrines fill up very fast. And if it's a hotel setting, nobody wants to come to that hotel because you eat in a hotel, then if you want to go for a long call, the hotel is very much full. Again, we do that to ensure that as a way of promoting public health and sanitation, we do treatment of such pit latrines because we have specialized bioenzymes, all right? We have specialized bioenzymes and microorganisms that we use to digest the human waste so that pit latrines do not fill up fast. Because we promote or encourage hygienic living. And by that, we ensure that our toilets don't fill up fast, right? Also, the toilet should be free of odor or flies, no odor, should be in a clean environment. That is part of what we do to promote clean and hygienic living. Last but not least, like we have mentioned, we do meat inspection. If you have a function, for example, you want to slaughter some goat for your visitors. If, for example, you're having a function and you slaughter an animal for your visitors, and then your visitors complain of, an issue like a stomach upset after the meal, it can be very negative on your part. So if you have a small function that you want to slaughter an animal for your nini, always for your visitors, always feel free to call Nepes to ensure that at least we promote public health by ensuring that that meat that is designated for consumption by the public is well inspected by qualified veterinary surgeons, and then you are now free to consume it and ensure that it is fit for human consumption.
Okay.
Yes.
Is government giving out protective regalias for veterinary doctors in the wake of COVID-19?
Unfortunately, no.
Or you are on your own?
We are on our own, I tell you. In fact, most of the part, we have had to incur the increased cost of the personal protective equipment. For example, as what you can see in your photo, that is a very good quality respiration mask. The market price almost goes for 1,500 shillings. So at individual level, we who are greatly involved in day-to-day prevention of these zoonotic diseases such as COVID-19 and others, we have to incur our personal expenses to ensure that we protect ourselves against, exposure to the condition. Because once we are down, then the whole system or a lot of other people will also suffer. So we need to be in the first line. The government has not been directly supportive in providing PPEs, especially for veterinary doctors in line of duty.
Okay. There was a time you guys had issues to do with taxation. Do you support tax holidays as was proposed by BBI?
Yes, we do, because you see, for example, as a young entrepreneur, because I was trained as a veterinary surgeon, and all I needed is to put my knowledge and skills into an entrepreneurial setup by forming a company called NAYPEST Limited. Now, for those who've done business, you know for sure that it takes a lot of effort for a company to grow and create a niche and make itself relevant to the market, such that without those tax holidays, it would be very difficult to grow. If at the very onset of your growth, the government wants all the tax and everybody's here, the city council is there and the county government is there and all this. So it becomes a hindrance for the growth of especially small and medium enterprises, because a NAPES, for example, is classified as a small and medium enterprise, whereby we put into use our professional knowledge to advance our career, but at the same time help society. So we grow as a business and grow as a profession. So that way, if there's one thing we need really is the support from the government through tax rebates and also a little tax holiday here and there on a mutually understandable basis that can help us grow like was being proposed in the VBI.
Okay, just reiterate on your contacts as people need to remember where your company is located and how they can access you.
Yeah, Nepes Limited.
Give your parting shots.
Our company Nepes Limited is located at Muthaiga Shopping Center. That is our physical address. In the same location where you'll find the Pet Center Veterinary Clinic. That is our physical address. In terms of our contact remains as seen on your screen: 0723 777 381, 0723 777 381, or you can email us at naypestlimited@gmail.com. So we really thank our viewers and listeners for taking their time out of their busy schedule to listen to us. And we would like to encourage people to always promote public health through fumigation, get rid of all the pests, get rid of all the pathogens, so that you can only create your own world. And that's exactly what we intend to do with NAPEST. We create your world. Within your world, if there are pests, call us and we will create a world free of pests where you are. Within your world, if you have pathogens, be it corona or any other disease condition, you call us, we disinfect your business premises, we disinfect your offices, we disinfect your industries, we disinfect your hotels and all those other places, so that we create a world free of pests and make this world a better place always.
Okay, thank you so much for honoring the invitation.
Yeah.
Today, I've been disappointed by the power. I'm actually in a blackout, but we've tried our best. Even my power is just going off.
So
But
sorry about that.
what we have is every Wednesday,
Yes.